In this slide deck, we're going to talk a little bit more about infectious disease in terms of public health and give you some specific examples that may help with some of your assignments. The transmission of communicable or infectious diseases actually depend on successful interaction of three things, which is the epi triangle. Those three things are the infectious agent, the host, and the environment. We did talk about this a little bit before, but we're going to go over it more in terms of infectious diseases. When we talk about the agent, there are four main categories of infectious agents that can cause a disease. This is a bacteria, a fungus, a parasite, or a virus. The individual agent may be described by its ability to cause disease and by the nature of the severity of disease. There are a few terms that actually can help you when it comes to infectious diseases. Infectivity is the ability to enter and multiply in the host. Pathogenicity is the ability to produce a specific clinical reaction after infection occurs. Virulence is the ability to produce severe pathological reaction. Toxicity is the ability to produce a poisonous reaction. Invasiveness is the ability to penetrate and spread throughout a tissue. Antigenicity is the ability to stimulate an immunological response. When we talk about the host factor, most of the time hosts are human or animals, and they can harbor any infectious agent. The characteristics of the host that may influence the spread of a disease include the resistance, the immunity, herd immunity, and infectiousness of the host. Resistance is the ability of a host to stop an infection from occurring, and it can actually involve natural or acquired immunity. There are actually different types of immunity. When we talk about natural immunity, this refers to species-determined innate resistance of an infectious agent. An example of this are that possums actually rarely contract rabies even when they're exposed to it because they're innately immune. Acquired immunity is the resistance acquired by a host as a result of previous natural exposure of the infectious agent. Having measles once protects you from future infection. Acquired immunity may be induced by active or passive immunization. Active immunization refers to the immunization of an individual by administration of an antigen, an infectious agent, or vaccine, and is usually characterized by the presence of an antibody produced in an individual. Vaccinating children against childhood diseases is an example of inducing active immunity. Passive immunization refers to immunization through the transfer of a specific antibody from an immunized individual to a non-immunized individual. This happens when the mom transfers an antibody to the baby through breastfeeding. Herd immunity refers to immunity of a group or community. It is the resistance of a group of people to an invasion or the spread of an infectious agent. It's based on the resistance of a lot of people being immune to an infection. It actually is the reason for increasing immunization coverage for vaccine-preventable diseases. Higher immunization coverage will lead to greater herd immunity. Infectiousness is actually the measure of a potential ability of an infected host to transmit the infection to other people. It reflects the relative ease with which the infectious agent is transmitted to others. The environment refers to the physical, biological, social, or cultural factors that are external to the human host. These environmental factors facilitate the transmission of an infectious agent from an infected host to a susceptible host. Reduction in communicable disease risk can be achieved by altering environmental factors. Examples of these are using mosquito nets or repellents for bug bites. Also, installing sewage systems and having regulations in terms of the selling, processing of raw meat are all ways that we change the environment.